Have you ever gone in for a routine test and come out with more anxiety than answers? If you're over 70, here's something most doctors don't say out loud. Not every medical exam is good for you. In fact, some can cause more stress, harm, or complications than the condition they're supposed to detect. Today, we're talking about 5 common medical exams that seniors over 70 may want to avoid, unless there's a very good reason to proceed. Because sometimes, doing less actually means living more. Let's take a closer look at what they are, and what you can do instead. 1. Routine PSA test for prostate cancer. The PSA, prostate-specific antigen, test is one of the most controversial screenings in men's health, especially after the age of 70. It was once thought to be a life-saving early detection tool. But in recent years, medical research has painted a more complicated picture. Here's the key issue. As men age, it's very common for PSA levels to naturally rise, even without cancer. And many men over 70 develop small, slow-growing prostate tumors that would never spread, never cause symptoms, and never shorten their lives. These are what doctors call clinically insignificant cancers. So why is the PSA test potentially harmful? Because once a high PSA level is found, most men are pressured into further testing, usually a biopsy. This involves inserting needles through the rectum into the prostate. It's not only uncomfortable, but it also carries risks of infection, bleeding, and urinary complications. And even when cancer is found, treatment can lead to urinary incontinence, erectile dysfunction, or other lifelong side effects, often for a cancer that didn't need treating. Let me tell you about Howard, 76, a retired engineer and father of 4. He felt perfectly healthy, but a routine PSA test came back elevated. Within weeks, he had a biopsy, and then a diagnosis of low-risk prostate cancer. His doctors gave him options, and he chose surgery, hoping to get rid of it. But after the procedure, Howard struggled with urinary leaks and intimacy issues. Years later, he regrets the entire process and says, "I wish someone had told me to wait and watch." The U.S. Preventive Services Task Force now recommends against routine PSA screening in men over 70, unless symptoms like pain, frequent urination, or family history are present. The benefits just don't outweigh the harms for most older men. The smarter path? Shared decision-making. Talk openly with your doctor. Ask, if I get this test and it shows something, what happens next? What are my options? If the road ahead looks risky and uncertain, and you feel well, it's okay to say no. In your 70s and beyond, the goal isn't to treat numbers on a lab report. The goal is to protect your quality of life. And sometimes, doing nothing is the most powerful choice you can make. 2. Colonoscopy after age 75. Colonoscopy is often seen as a gold standard for detecting colon cancer. And for adults in their 50s or 60s, it can indeed be life-saving. But after age 75, the equation changes dramatically. Because colorectal cancer is usually a slow-growing disease. If you've had previous colonoscopies that were clear, and you're not showing new symptoms, the likelihood of developing a dangerous form of colon cancer that progresses rapidly after 75 is very low. Meanwhile, the risks of the procedure itself increase with age. Seniors are more vulnerable to complications from sedation, dehydration from bowel prep, and even falls or fainting during preparation. The older you get, the more fragile your system becomes, especially if you have other conditions like heart disease, diabetes, or balance issues. Let's revisit Margaret, age 78. Her doctor suggested a routine follow-up colonoscopy, even though her last test at 70 was normal. Preparing for the test, she had to fast and drink large volumes of bowel cleansing solution. Weak and lightheaded, she slipped on the bathroom floor and fractured her hip. The colonoscopy revealed no problems, but the fall changed her life. She needed surgery, lost her independence for months, and suffered emotionally from the sudden loss of mobility. This isn't an isolated story. Studies show that after age 75, the risk of harm from colonoscopy may actually outweigh the potential benefits, especially when there are no symptoms. So what are the alternatives? For most people over 75 in good health, non-invasive stool tests like the FIT test or fecal DNA tests, like Cologuard, offer a much safer screening option. These can detect blood or genetic markers in your stool that signal problems, without the trauma of anesthesia or invasive scopes. The most important takeaway? Talk to your doctor based on your personal history, not just your age. If your colon has been healthy for decades and you're feeling well, pushing for another invasive exam might be unnecessary and even harmful. Aging wisely means knowing when to step back from over-testing and when to focus instead on what truly supports your health: good food, regular movement, staying socially connected, and protecting your independence. Your well-being isn't measured by how many tests you take, it's measured by how well you live. 3. Annual full-body scans without symptoms. The idea of a full-body scan sounds appealing, doesn't it? A high-tech machine looking at every inch of your body, just in case something is brewing. It gives the illusion of control. But here's the uncomfortable truth. These scans are often a Pandora's box. Let's talk about what they actually find. Full-body CT or MRI scans frequently reveal what doctors call incidentalomas, incidental findings that look unusual but are completely harmless. In older adults, it's normal for organs and tissues to change slightly with age. But machines don't know that. They flag anything even slightly irregular, sending patients into a cycle of additional tests, biopsies, worry, and in some cases, surgery. Take Leonard, 81, whose children gifted him a full-body scan for his birthday. The scan found a 1.5 centimeters shadow on his liver. He'd never had pain or symptoms. But that vague spot led to weeks of blood tests, 2 separate imaging appointments, and finally a liver biopsy, only to find it was a benign cyst he'd likely had for decades. What did Leonard gain from all that? Nothing. But he lost sleep, spent hundreds of dollars, and walked away from the experience more anxious about his body than ever before. There's also radiation exposure to consider. A full-body CT scan exposes you to significant radiation, roughly equivalent to 100 chest X-rays. For older adults, the cumulative exposure from multiple scans over time can increase the risk of developing new cancers, ironically from the very test meant to detect them. Experts from the American College of Radiology and the FDA do not recommend routine full-body scans for individuals without symptoms. They emphasize that these procedures are best used when you and your doctor are looking for something specific, not fishing for problems. The takeaway here? Peace of mind doesn't come from endless scanning. It comes from listening to your body, maintaining healthy routines, and having a doctor who looks at you, not just your scan. At 70 and beyond, it's time to replace fear-driven healthcare with thoughtful, personalized choices. Don't let machines dictate your well-being. You are not a data point. You're a human being with wisdom, history, and the right to choose less testing and more living. For cervical cancer screening after 65. For decades, women have been taught to faithfully attend their pap smears and HPV tests, and rightly so. These screenings have saved countless lives by detecting cervical cancer early. But what many women aren't told is that after age 65, regular screening is often no longer necessary, and in some cases, may cause more harm than benefit. Why the shift? Because cervical cancer typically develops slowly, often taking 10 to 20 years to become dangerous. If a woman has had 3 consecutive normal pap smears or 2 negative HPV tests in the last 10 years, and no history of cervical precancer or high-risk HPV, she is considered low risk. Continuing to screen beyond that point, especially into the 70s or 80s, rarely finds anything new, but it often generates confusion, fear, or false alarms. Take Elaine, 72, a retired teacher. She'd had a clean bill of gynecological health for decades. But a new doctor insisted on continuing pap smears, just to be safe. Her test came back abnormal, which sent her spiraling into anxiety. She underwent a painful cervical biopsy, only to learn that the result was likely due to natural vaginal thinning, atrophic changes, common after menopause, not cancer. Elaine told her daughter afterward, "I wish I hadn't gone at all." This is a common and heartbreaking story. Studies show that the rate of false positives increases with age, as postmenopausal changes in the cervix and vaginal tissue can mimic abnormal cells. These can trigger unnecessary procedures, biopsies, and emotional distress. Medical guidelines from the U.S. Preventive Services Task Force and the American College of Obstetricians and Gynecologists are now clear. Women over 65 who meet the screening criteria can safely stop testing. That said, it's important to distinguish between screening and diagnosis. If you have symptoms, bleeding, pain, unusual discharge, those still warrant evaluation. But routine testing without symptoms or risk factors is no longer helpful. Ending cervical cancer screening doesn't mean giving up on your health. It means acknowledging that your past prevention efforts have paid off, and now you can move forward without unnecessary fear or invasive exams. Your body deserves dignity, and so do you. 5. Bone density tests more than every 2 years. Osteoporosis is a legitimate concern as we age, especially for postmenopausal women. But in our effort to stay ahead of the problem, many seniors are being overtested and overtreated. The DEXA scan, or bone density test, is the standard method for measuring bone strength. It's painless and relatively quick. But here's what most patients don't hear. If your bone density is stable and you're already on treatment, testing more than once every 2 years is unnecessary and may even be misleading. Because bone density changes slowly, very slowly. In most people, especially those on medications like bisphosphonates or with no new fractures or risk factors, bone density doesn't fluctuate enough from year to year to justify repeat scanning. Yet many doctors order annual scans, sometimes out of habit, sometimes out of fear of missing a decline. Let's return to Ruth, 76, who has been taking medication for osteoporosis for nearly a decade. Her doctor scheduled a DEXA scan every 12 months. Despite national guidelines recommending scans every 2 to 3 years unless there's a major health event. Ruth's results barely changed, but the slight year-to-year variations were enough to cause unnecessary worry and even prompted a change in medication, despite no fractures and no new symptoms. Overtesting can lead to overtreatment, such as switching to stronger medications with harsh side effects, like jaw problems, digestive issues, or even rare fractures from long-term drug use. Instead of obsessing over numbers on a scan, focus on what truly matters for bone health. Weight-bearing exercises, like walking or light strength training. Calcium and vitamin D-rich diet. Fall prevention strategies, removing tripping hazards, improving lighting, and using supportive footwear. And perhaps most importantly, remember, one stable scan is not a ticking clock. It's a sign you're doing something right. Trust your history, not just the scan. Aging well is about strength, balance, and the freedom to move, not repeating tests just because the calendar says so. Final reflection. Your health, your voice medical testing should empower you, not frighten you. At 70 and beyond, your time, energy, and peace of mind are more valuable than ever. It's okay to ask your doctor, do I really need this test? Sometimes, the smartest decision is to say no. So, did any of these surprise you? Have you had an experience like George or Margaret? I'd love to hear your story in the comments. And if this video helped clarify something for you, please give it a like, subscribe, and share it with someone you care about. Because the more we understand our aging bodies, the more power we have to protect them wisely.